As of the latest update from the Department of Health, the country has now 307 confirmed COVID-19 cases. Death toll is at 19, while 13 have recovered. Daryl Marie Sarmiento of GMA Regional TV 1 Western Visayas will give us more updates. Daryl?
Said 77 new positive COVID-19 cases were recorded in the Philippines today, bringing a total of 307 confirmed cases. The death toll due to COVID-19 in the country is now at 19, following the death of a former dean of the University of the Philippines Asian Center early this morning. Dr. Aileen Baviera died of pneumonia caused by COVID-19. DOH also announced 5 more patients who recovered from the disease, raising the total number of recoveries to 13. The Department of Health Region 6 has confirmed in today's press conference 2 confirmed COVID-19 cases in Western Visayas. The first case in the region is a 56-year-old man from Bacolod City who has a travel history to London and arrived in Bacolod City on February 19. He is confined at the hospital in Bacolod and is stable and recovering. Bacolod City Mayor Evilio Lunardia has ordered the City Health Office to conduct intensive contact tracing of the patient. Today, the DOH-6 received the confirmatory result of a 65-year-old man from the town of Gimbal, Iloilo. According to DOH, the patient is currently confined in a hospital in Iloilo City. He has no travel history from COVID-infected areas, but was exposed to his relatives who came from Japan.
Positive case of COVID-19. So the Department of Health, Western Visayas Center for Health Development, reports today, March 21, 2020, the second positive case of COVID-19 in the region.
The health department of the local government unit is currently conducting contact tracing. The Department of Health confirmed Cebu's first COVID-19 positive case. According to DOH Region 7 Director Dr. Jaime Bernadas, the patient is currently confined in a private hospital in Mindanao City and is now recovering. The patient is a 65-year-old man who had no travel history abroad, but recently visited Mindanao and Metro Manila. Upon his return to Cebu on the 6th or 7th of March, he was admitted for respiratory symptoms and immediately monitored as a PUI. A swab sample was taken in the second week of March, and the test came back positive on March 18. March 15, when the first confirmed COVID-19 case in Negros Oriental died. Patient 39 was a counselor from Tayasan, Negros Oriental, who has a travel history in Manila. In the Davao region, the first confirmed COVID-19 positive case was recorded in Tagum City, Davao del Norte. Tagged as patient 130, the 21-year-old female from Pantucan, Davao de Oro, was confined at the Davao Regional Medical Center in Tagum City last March 10 and confirmed positive on March 15. She traveled from the United Kingdom to Qatar before arriving in Manila, then Davao last February 29. Aside from contact tracing, the DOH has also asked passengers who may have taken PAL flight PR 2815 last February 29 to coordinate with him. Meanwhile, 3 of 88 PUIs recorded in Davao region died while awaiting their COVID-19 test results. There are over 6,300 PUMs nationwide. Tragically, after being cleared from the virus, 1 PUM died in a freak accident. Meanwhile, the first COVID-19 positive case in Mindanao, tagged as patient 40, passed away last March 13. He was a 54-year-old male from Lanao del Sur and was confined at Northern Mindanao Medical Center in Cagayan de Oro City. He was confirmed COVID-19 positive last March 11. He was buried through traditional Islamic burial rites and according to DOH protocol. The third COVID-19 positive case in Mindanao was recorded in Cotabato City. The third case was tagged as patient 145, a 32-year-old male who is currently confined at the Cotabato Regional and Medical Center in Cotabato City. He was one of the tabligs who joined the Ijtima Johor, held in Malaysia last month. He arrived in Manila from Malaysia last March 3 and traveled to Cotabato City a day after. He was confirmed positive of the virus last Tuesday. The fourth case in Mindanao was tagged patient 201, a 58-year-old male from Lanao del Sur who was also one of the tabligh who joined the said Muslim congregation in Malaysia. He was admitted at Amay Pakpak Medical Center in Marawi City last March 10. He died last Wednesday, a day before he was confirmed COVID-19 positive. He was buried through traditional Islamic burial rites and according to DOH protocol. 4 confirmed cases were recorded in North Central Luzon. In Manabo, Abra, a 39-year-old seaman who arrived from the United Arab Emirates tested positive for COVID-19. The seaman returned to the Philippines on March 8, 2020. While in Baguio City, Mayor Benjamin Magalong confirmed in a press conference that 2 of the 4 highly probable cases in the city tested positive. One of the patients was brought to St. Luke's Medical Center in Metro Manila, while the other patient is in isolation at the Baguio General Hospital and Medical Center. And in Pangasinan, the Provincial Health Office confirmed that the first COVID-19 positive case from the province was a resident of Barangay Bicol Norte, Bayambang. According to Mayor Cesar Quiambao, the patient, a medical doctor by profession in his 70s, was admitted in a hospital in the Cupan City and later transferred to the Lung Center in Manila. The patient passed away on Friday. The whole municipality is now under total lockdown until March 28. Local authorities will sanitize the barangay and implement precautionary measures. As of the latest data, North Central Luzon has a total of 7 confirmed COVID-19 cases, 3 in Pampanga, 1 in Abra, 1 in Pangasinan, and 2 in La Union. 2 were confirmed dead. Said the Department of Health continues to remind the public to stay in their houses and observe home quarantine procedures, as well as follow the mandates issued by the respective local government units to prevent further spread of the virus. Said,
We really hope we could overcome this COVID-19 pandemic soon. Thank you very much, Daryl Marie Sarmiento of GMA Regional TV 1 Western Visayas.